Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 21st of September. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, Student Research Assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Thank you, Sophie.
In the United States yesterday, we saw 51,000 positive new cases, with the number of cases decreasing by 24% over the last 7 days, with our 7-day average being about 57,000 positive new cases. Hospitalizations have decreased by 13% in the United States as a whole, and the death rate has decreased by 2% in the United States as a whole. In Illinois, yesterday, we saw roughly 2,000 positive new cases, with our 7-day average being about 2,143 positive cases per day, and there's a 36% decrease over the last 14 days. While hospitalizations have decreased by 6%, the death rate in Illinois has increased by 35%. What can you tell us about what do these numbers mean with this typical fall spike in cases that we should be seeing?
Right. The case numbers are going in the right direction. But remember, these are only the reported cases that had a test done at a certified laboratory. So all the home tests, which is more than what's being reported. I don't know how much more, but it could be 5 times as much. We don't really know. So the number is really much higher, because what I'm just seeing in the population, in my patients, is people are getting COVID everywhere. I mean, it seems like it's a lot, but they're having relatively mild disease. Most are vaccinated, and the ones that are eligible are taking Paxlovid. So the hospitalization rate has dropped, and that's a really good sign, but the infection rate has not. And then the death rate, as you said, is already pretty low, about 400 cases a day in the United States, popped up a little bit in Illinois. Part of the problem is when the numbers are low, and any kind of change, like say they didn't report for 3 days and then they report them, the percentage looks really high, but the actual numbers have stayed relatively stable at about 400 cases per day. That's still 4 times higher than the flu. So it's not a disease to be taken lightly. People do get sick, but if you're vaccinated, boosted, take Paxlovid or whatever therapy is available to you, you'll do okay. Now, this new vaccine, the bivalent vaccine that is out just a week now, may protect against infection because it works against Omicron. So it's very important to get the new booster as soon as possible.
Wonderful. So with all of those statistics in mind and what you just told us, our big headline is that the WHO has now said, quote, "The end is in sight for COVID pandemic as global deaths have hit lowest since March of 2020. Okay, so are we close to the end? What does that mean?
We're heading towards the end. And so this is all a good sign. And this is worldwide. Remember, it is a pandemic. It's not just the United States. If we don't get this thing treated everywhere, we're never going to win. So this is very encouraging. Now, if you remember back to last summer, in July, around July 4th and the month of July, we were kind of in the same boat. Matter of fact, there were fewer deaths back then. And everybody thought, hey, this is the end. And it obviously was not the end, because what happened at the end of the summer was Delta. Delta caused this big spike, and Delta was a more difficult infection to treat, a nastier infection. And then Delta hadn't even gone away, and Omicron took over, and there was this massive spike in January and February. So,
right.
If this thing is mutating right now, things are a little bit under control. That's great, and let's hope it stays that way. But let's keep up with the boosters, and let's keep up with the treatment if you're eligible.
Yes, absolutely. Now moving into our monkeypox headline. Chinese health officials is now warning to not touch foreigners, as China is now seeing their first monkeypox case.
Yeah, so monkeypox is everywhere, China included, and it is spread by touching. it's a contact type transmission. So in a way, they're right, but it's just kind of funny from China that they're just coming right out and say, don't touch foreigners, all foreigners, bringing monkeypox into China. But if it gets in there, they're going to have to worry about touching other people too, Chinese included. But yeah, the monkeypox is everywhere, and they got it too. But it's going down.
Yeah.
Overall cases are going down because it is relatively hard to transmit. If you don't touch people who have the lesions, you're not going to get it. So it's already going down. People are being vaccinated for it. There is a treatment for it already. And finally, all that stuff, all of those actions and mitigations got into line pretty quickly, and it's working.
Wonderful. And now for our 3 COVID questions. Our first one being, what is the current data suggesting about mitigating risks in indoor pools when either lap swimming or doing aerobic exercises in the pool?
Yeah, well, there's no evidence that COVID can be spread in water, swimming pools or lakes, splash pads, fresher marine water, whatever, lakes. And so, as long as the pool is receiving proper maintenance and everything, there shouldn't really be a risk. And this was actually through the whole pandemic. I remember we had questions very early in the pandemic about being in swimming pools, even before the vaccines were available. And there doesn't seem to be any transmission related to swimming pools.
Wonderful. Now for a second COVID headline. This individual says, my husband and I are in our late 60s and have never had COVID. We mask everywhere and limit our social interactions. Their initial vaccines were Pfizer, then a Pfizer booster, and they got their Moderna booster, their second booster, in April of 2022. They didn't have much of a reaction. Which company do you suggest getting, being that they are getting their flu shot at around the same time?
Well, both of these vaccines are geared towards the Omicron. So half of it is the Omicron vaccine and half is the regular vaccine. So all the vaccine variants that existed should be covered pretty much by this new bivalent vaccine. Now, they've had Pfizer and they've had Moderna. So the mixing and matching may actually be good. We found out after the fact. And they can take any one, whatever's available. Doesn't really make any difference. They can flip back and forth. And they should get it as soon as possible because they were in April. And so this is already September. So they should just get whatever is available of those, and no big preference. If they had only had Pfizer up until now, I would say get the Moderna, or vice versa. If they had the Moderna, I'd say get the Pfizer. Doesn't really make any difference.
Wonderful. All right. And now for our last question. This individual is 68 years old and was diagnosed with stage 4 metastatic breast cancer, and they are on oral chemotherapy and scanned every 3 months. They are triple vaccinated with the Moderna booster and a Pfizer booster in April of 2020. And they're wondering when they should get their next booster with their upcoming PET/CT scan.
Yeah, this is super important because if you have a CT scan or a PET scan, any kind of scan like that, it's going to pick up a change in the size of the lymph nodes. After you have the vaccine, the lymph nodes in the armpit of the arm that got the vaccination can swell. So that could confuse the results of any kind of scan that's looking in that area. So for anybody getting these routine scans like this person is getting, they should get their vaccine right after they have their next PET scan or CAT scan.
Wonderful.
So that
and now
the vaccine-induced lymph node to decrease.
Wonderful. Well, those were all of our COVID questions for today. Thank you so much, Dr. Murphy.
Great questions too. Thank you.
We'll see you next week.